Telehealth visits are often discussed as an emergency solution or a technological shortcut, but their current form reveals a more deliberate shift. Telehealth did not emerge to replace medicine. It emerged to correct a mismatch between how care is delivered and how health is experienced. Traditional healthcare assumes that care begins at a place, a clinic, a hospital, an office. Patients travel to that place, enter a system, and wait to be seen. This model evolved when illness was primarily physical, immediate, and observable. A fever, an injury, an infection. Diagnosis required presence because tools and expertise were centralized. Over time, the nature of care changed. Advances in treatment turned many acute illnesses into chronic conditions. Management replaced intervention. Care became ongoing rather than episodic. Patients returned not because something dramatic had happened, but because something needed adjustment. Yet the delivery model did not adapt at the same pace. A 10-minute conversation about side effects still required a day of planning. Transportation, time off work, childcare, waiting rooms. The cost of access became disproportionate to the value of the interaction. The problem telehealth addresses is not distance alone. It is interruption. Healthcare visits interrupt lives. They break routines, consume energy, and create stress unrelated to the medical issue itself. For patients already dealing with illness, this added burden often delayed care. Appointments were postponed not because symptoms were mild, but because the effort to be seen felt overwhelming. Early digital healthcare efforts focused on efficiency from the provider's perspective. Electronic records, portals, automated scheduling, these improved administration, but did little to change the patient's experience of access. Information moved faster, but care did not feel closer. Telehealth changed the unit of care. Instead of centering the clinic, it centered the interaction. This shift required accepting trade-offs. Physical exams are limited. Certain diagnostics are impossible remotely. Subtle cues can be missed. But these losses were weighed against a different gain: continuity. Telehealth works best where the goal is understanding, reassurance, monitoring, or guidance. In these contexts, presence matters less than availability. Seeing a clinician sooner, even through a screen, often prevents escalation. Questions get answered before they become emergencies. The design constraints of telehealth reflect this priority. Video quality needs to be adequate, not cinematic. Audio clarity matters more than resolution. Platforms emphasize stability and privacy over features. The interface is intentionally simple. Complexity increases anxiety. Scheduling flexibility is central. Telehealth compresses waiting time, but it also redistributes it. Instead of sitting in a waiting room, patients wait in familiar spaces. The psychological difference is significant. Control returns to the patient. The moment of realization comes when you notice that many telehealth visits feel more personal than in-person ones. Without the ritual of the exam room, conversation becomes the focus. Clinicians listen differently. Patients speak from their own environments. Context appears naturally. This does not replace physical care. It reframes it. Telehealth separates what requires touch from what requires attention. By doing so, it makes in-person visits more meaningful when they happen. Human behavior plays a quiet role here. People are more likely to seek help when barriers are low. They are more honest when comfortable. They follow up more consistently when access feels humane. Telehealth also changes how illness fits into daily life. Care no longer demands withdrawal from routine. It integrates into it. This reduces the emotional weight of being a patient. Health becomes something managed alongside life, not apart from it. The system is not perfect. Equity, access to technology, and quality of connection remain challenges. But the form telehealth has taken reflects a clear understanding. The greatest obstacle to care was never knowledge or skill. It was friction. This is the invisible design behind telehealth visits. A system shaped less by medical instruments and more by human limits. It exists not to replace doctors, but to protect the fragile moment when someone decides to ask for help. When telehealth works well, it doesn't feel like a downgrade. It feels like relief. And that relief is the signal that design has quietly aligned care with how people actually live.